Our next speaker is Tanya Washington-Stern. She's the Chief of Staff at the DC Office of Planning. At the Office of Planning, Tanya has overseen agency management, legislative outreach, communications, special projects for the agency since March of 2010. And the Office of Planning performs neighborhood and citywide planning for the District of Columbia, engages in urban design, economic housing planning, zoning reviews, GIS mapping, and houses the District State Historic Preservation Office and State Data Center. Tanya didn't get to eat too much last night because we were just bending her ear about all the fantastic things she's doing in DC, linking in public health with the city planning to come up with a sustainable obesity prevention strategies, and she's going to tell you about it today.
Good morning, and thank you for the opportunity to be here today to meet with partners throughout the world to talk about obesity issues. I am a city planner by training. I do not have a public health background, but through the work that my agency has done on obesity issues and partnering with other agencies, including our Department of Health, I've definitely have seen over the last number of years that the planning field has become much more aware of the importance of the impact of the built environment on public health outcomes. And so there's a lot more partnerships that are beginning to occur. And some of the other speakers, particularly on this panel as well as before, have already talked about how it isn't enough to just do the clinical interventions, but there are a lot of other entities, such as our transportation departments and others, who play a role in reducing obesity. So I'm basically going to give an overview of what we've been doing in Washington, D.C. on this issue. And I'll start with just giving you a snapshot of obesity in D.C. This is really an epidemic in our city. It is a major concern of our mayor, of our health department. 55% of adults and 35% of children are obese or overweight. 1 out of 3 children are at risk of being overweight or is already overweight. And as some of the other speakers have talked about, obesity is really driving some of the chronic diseases that are causing significant death rates in the city. 5 of the top 10 causes of death are related to poor diet, minimal physical activity, and excess weight, and all of those are factors in obesity. And another thing I wanted to point out is, which I believe Professor Janowski talked about, obesity rates really vary across the city. Washington, D.C. is divided up into 8 wards. Those are their sort of sub-political representation areas. And that's how we track a lot of data in our city. And as you can see, in Ward 3, and I'll have a map of the city shortly, the obesity rate in 2009 was 7.9%. But in other parts of the city, such as Ward 8, it was 38.5%. And so that's something that we're very aware of, about how the obesity incidence really varies, and that we have to be very targeted in what kind of strategies we use, not just in terms of what we do, but where we make these kinds of investments. So this was the map I was just talking about. Let's see. Whoops. I'll just focus on the map. So as you can see, which button is it? Stop one. Okay, thank you. So this is Ward 3, which I was just talking about, and Ward 8 is down here. This is the ward that has the highest obesity rate in the city. This ward has the lowest. This is a map that our GIS division produced, which maps where the current grocery stores are located in the city. And as you can see, in some wards, there are a lot of grocery stores, and other wards have very few. One of the things you will notice is that, for instance, in Ward 8, there's really only 1 grocery store, but Ward 3 has several. We've also overlapped where there are higher incidences of poverty as well. and what we call insufficient food access, and we define that as people being able to walk to a grocery store within 15 minutes of their home. And what we are finding is that the areas that tend to have the highest obesity rates are areas that also have insufficient food access. There are fewer grocery stores. They have to go a lot farther to access grocery stores. And on top of that, you have poverty issues as well. So these are real challenges, and it really highlights the fact that again, it isn't enough to just do the clinical interventions. There are a lot of other strategies that are involved in this. This is just some information from a study that was done a few years ago that talked about how significant the built environment is on public health. Essentially, where there are a lot of fast food restaurants or corner stores, but few grocery stores, it reduces the ability of people to access healthy foods, and oftentimes will increase the prevalence of obesity. But on the flip side, if you have someone who lives in a highly walkable mixed-use community, they may or may not have good grocery store access, but they're going to be able to get a lot more exercise, and so that's one intervention that is a direct influence of the built environment. Again, people who tend to use public transit also oftentimes get a lot more physical activity as well. And again, if you live near a park, that's another opportunity to engage in healthy living. So these are other types of interventions that are really much more dependent upon the built environment that subsequently have a result or an impact on public health. So this slide kind of highlights the perspective that my agency really focuses on. As a planning agency, we do not do direct obesity efforts such as those things that are done by our Department of Health, but we do play a role in this, and what we do is look at how can we design the built environment so that we can help to improve people's health outcomes. What are some of the things, or what types of other types of investments, such as increasing transportation options, increasing the ability of residents to be able to walk safely around their neighborhood and to access a lot of amenities, to be able to increase access to grocery stores. These are all things that we really think about as we develop plans in our city, and essentially we're asking ourselves, how can we make our communities healthier by design? Sorry, having issue with my slides here. So this is another initiative that the district recently embarked on. The mayor launched an initiative called Sustainable DC last summer, Mayor Gray, and since then we've developed a vision for a sustainable DC that came out in April. And this initiative really looks at how the district can be a leader in sustainability, and we take a very broad view. It's not just environmental sustainability, but it looks at a number of other issues such as health, the climate, food access, jobs. But one of the goals that came out of this study, or out of this vision, it's a 20-year goal, is to reduce the district's obesity rate by 50%. And we're now at the point of trying to figure out what types of further investments the district can make in order to achieve this goal. But I also wanted to focus on this because, again, this is another area that is not specifically, it's about public health, but the interventions involve a lot more things beyond your typical public health interventions. This slide really shows how the district has gone about fighting obesity over the last several years. And I really particularly like this because it shows that there's actually a pretty broad range of things that you can do that in some instances may be very focused deliberately on reducing obesity rate, or in other cases are investments that we have made that have as a side effect hopefully having a positive effect on public health. There has been some legislation that our DC Council has passed over the last couple of years. One is the Feed DC Act, that is the Food, Environmental, and Economic Development of the District of Columbia Act, and that really focuses on increasing, providing further incentives to attract supermarkets, particularly to those areas that have very few. It also has a healthy corner store program so that those communities that do have a lot of corner stores can use that as a venue to access healthy foods. There's also the Healthy Schools Act that passed a couple of years ago, and that created new nutrition standards for schools. It also created or mandated that schools have to have a school gardening program. And so the intent behind that is that with children, you're focusing not just on what kinds of improvements you can do at home, but to use the schools as a way to help to make those kinds of interventions. We've also had a number of infrastructure investments, particularly in the transportation area over the last several years. The district has over 50 miles of bike lanes throughout the city. We also have a program called Capital Bike Share, which is a bike sharing program. There are over, I believe, 140 stations within the District of Columbia and Arlington, Virginia, which is right across the river, and over 1,200 bikes. And this is a membership-based program where you can basically go to a station, take out a bike, ride it to another part of the city, and park it at a station. And so that really increases people's ability to get around town. And also recently, the district announced a large-scale playground renovations. I actually used to work for the Department of Parks and Recreation a number of years ago, and that was a big issue of concern that I used to hear from community members was the quality of the playgrounds and how they really weren't very safe. And so the mayor recently announced $9 million in capital improvements to playground renovations. We also have business incentives. We have a supermarket tax incentive program, and that is a 10-year tax exemptions in areas such as real property taxes. As I mentioned before, we've got the Healthy Corner Store program, and we have other initiatives going on within the district that intersect or support anti-obesity efforts. And as I mentioned earlier, the district has been investing in a lot of multimodal transportation options. This kind of gives you an overview. We have our Metro Rail system, which has been in existence since the 1970s. We also have, as I mentioned, our bike lanes and Capital Bike Share program, and we also have car sharing programs. And these are particularly helpful for residents who live in parts of town where they do not own a car, and if they need to get to a grocery store because it isn't close by, they have to, this is a way that they can get around town. So I think we've talked a little bit about this, but just very briefly, we all know that obesity increases medical costs, and I just wanted to highlight that overweight and obesity in the district has cost us almost $400 million annually just in medical costs. And then finally, as some of the other speakers have said, obesity really has other types of economic costs. There are productivity costs, and there's a study that the Brookings Institution has done that also talks about human capital and transportation costs that they noted really need some further research, but that there really are some other areas where there are economic costs. Thank you.